breast cancer has become a key issue in the whole Ghana as a whole, like not in a district per se. It's in its rising states at the moment. People are dying as a result of this breast cancer issue. So as we came here today, we came to do the screening. And then for you to diagnose people as they having breast cancer, it's not just a quick thing. You do the screening, and when there's a lump in it, we call it at the detection stage. So they are to be referred to the higher level for a mammogram to be done so that they pick it up from there. One may ask why breast cancer or why the screening at all. It's because when they get it, the cure alone is an issue, because people don't even go for regular checkups, and then the lumps will be there and be growing till it gets to the cancer stage before they report to the facility for any other thing to be done. So we go on monitoring to do this screening frequently. So breast cancer as a whole is when the cells of the breast begin to grow excessively than the normal. Then we say people are getting the breast cancer, or it's a detection of a breast cancer issue. So people who normally get ranges from age of 50 upwards, those in their menopausal age previously, but at the moment people in their teen are getting it. It's becoming rampant in the system. So people with 35 years and above are also getting it. So what actually causes breast cancer? The cause of breast cancer currently is unknown, but we have some predisposing factors. So the predisposing factors, you being a lady or a female, as a gender base, you are predisposed to get breast cancer. And those, as I said, with age 50 and above, they are also predisposed to get breast cancer. Those who start their menarche so early are also predisposed to get breast cancer. People with dense tissues of the breast are also predisposed to get breast cancer. And then it's also a genetic. So people's family, they have that lineage kind of thing. Maybe their grandmothers previously had it, but they didn't know, or they didn't even see those people. So when it runs through the family, then people in that family are surely predisposed to get breast cancer. So normally, these are some of the predisposing factors or high-risk areas people might have get breast cancer from. I identify one woman who is 36 years old. But for her, she even told me earlier on that she felt something in the breast. So by the examination, I also saw that lump. It was a little bit huge. It was at the base of the left breast, getting to the axiillary. So we've done a referral to the hospital for a mammogram to be done. Then we'll pick her up from there. So I asked her why she has seen it and not been attending to the hospital. She says she doesn't have money. So normally this is the issue people are getting. They will do screening for them, they will see it, referral will come in, but for them to push to the facility for healthcare to continue, then they will relax because of monetary issues. And then by the time you see them, the thing has radiated to the certain level that becomes so huge, and then I mean, debated that it can't even resolve so early with even medication. Then surgical intervention, that is where the proper treatment comes in. That is where the proper treatment comes in. But this, at the moment, the treatment is not yet in because he hasn't started anything at all. Breast cancer, you cannot just say it's a spiritual issue, because as I was narrating the causes, we don't even have the causative organism at the moment, but we have the predisposing factors. So when you are in line with this predisposing factors, then definitely you are eligible to get it. So we should rather look at it from the aspect of medical than spiritual base. So it's not a kind of spiritual diseases, but it's a medically consult, not spiritual anyway. So my general advice to the public is that all female, when you are born to be a female, definitely you have these issues of cancers, including even the cervical cancer. And that is why the government has taken it upon themselves to be doing screening some months and other things. So in January, we will do we have the cervical cancer screening and breast cancer screening. In the whole year, we have this activity being done in various hospitals. So whenever you hear they are doing screening anywhere, don't sit. You have to just reach to the nearby facility for this screening. If you are not doing the mop-up too, and you are closer to any facility in Ghana where healthcare is being done, just walk in. I want to do this examination, and hopefully it will be done for you. It's not all that costly that people presume is costly. For breast examination, it's not being charged. It's free. At times, if they will charge, it's just 10 cedis. And it's normally not charged. For instance, when you go for screening and they ask you to go and do breast examination, it's part of your care. And for that matter, you are not going to pay anything as a result. By the cervical screening, that's at times you pay something small. I'm a midwife working at the Sunyani Teaching Hospital.
Your name?
I'm Evrlyn.
A midwife?
Yes, please. Signs and symptoms of this breast cancer. So some people will get pain in the breast. There will be some spots on the breast. At times there will be discoloration of the breast tissue. I mean the skin of the breast. Some will be darkened, others you see it being reddened. And then there's a lump on palpation. When you palpate the breast, you can see some lumps in the breast. These are all initial signs that you can see. Some will come with discharges, either plain color, milky at times too. Some will discharge even bloody. And then we have the darkened aspect of the skin, the tissues of the breast. Places will be darkened. And when it's getting to the final stage of it, you will see this pinpoint or dotted aspect of the skin. It looks like orange peel. You see a dotted, like a pinpoint something on the site where the breast cancer is actually happening to the woman. So these are some of the signs you normally see on this breast that is suffering from this cancer.
Is it painful?
Yeah, it's painful at times. It's very painful. When it gets into the end stage of it, it becomes more painful. And even there will be sore. At times, sore will be on the, not even at times. When it gets to the later stages of the breast cancer, it becomes sore. It becomes sore. So it's not easy, as we are saying. When people suffering from it are really going through a lot. They are really going through a lot. It's not severe from the onset, but it becomes severe without treatment. It becomes so severe when the person doesn't go for treatment at all.